All right, let's dive right into this explainer and unravel a pretty chilling biological mystery. I want you to imagine stepping onto a luxury cruise ship for the absolute trip of a lifetime to the Antarctic, only to find yourself trapped in a medical nightmare. Today, we're looking at a pathogen that recently stepped out of the wilderness and onto the high seas, totally rewriting everything we thought we knew about it. We are talking about the Huntavirus.
50%. Just let that number sink in for a second. That represents the staggering mortality rate of hantavirus when it infects humans. It's an astonishingly lethal pathogen. It is essentially a coin toss for survival. And while that number alone is terrifying, it's what this virus has just learned to do that has global health authorities on such high alert. So this brings us to the real breaking news hook of our explainer today. The World Health Organization recently put out a statement indicating that human-to-human transmission of the Andes strain of hantavirus likely occurred between close contacts on board the May 2026 MV Honjas cruise ship, specifically a married couple sharing a cabin. This is a massive, unprecedented shift in this virus's behavior. Let's track exactly how this dream Antarctic vacation turned into a deadly crisis at sea. The Dutch-flagged MV Hondias departed Argentina on April 1, 2026. By May, an outbreak had violently swept through the ship, resulting in 7 reported cases and 3 tragic deaths. Passengers rapidly progressed from just a standard fever and gastrointestinal issues to pneumonia, acute respiratory distress, and eventually shock. By May 29th, the CDC had to issue an urgent report on the event. Now, the absolutely crucial takeaway here is that this outbreak literally rewrote the rulebook. Prior to the Hondias event, human-to-human transmission of hantavirus had never been firmly established. We always thought you had to be directly exposed to infected rodents. This event tells us the Andes strain is adapting, and it proves how quickly an isolated viral mutation can become a global maritime emergency. Section 1. What is hantavirus? Origins and vectors. To really understand this threat, we have to trace it back to its historical roots. The virus actually gets its kind of peculiar name from the Hanta River in South Korea. Between 1976 and 1978, scientists isolated it while studying a disease then known as Korean hemorrhagic fever. They traced it all the way back to striped field mice captured right near the riverbanks. So at the time, it was a very localized, environment-specific discovery. Biologically speaking, hantavirus is what we call a negative-sense RNA virus. Because it's negative-sense, the virus actually has to pack its own polymerase enzyme just to make mRNA inside our cells. But what you should really take away from this is that hantavirus is highly adapted to rodents. It lacks the biological machinery to survive in insects, which means there's no way you can get it from a mosquito or a tick bite. It relies strictly on its mammalian hosts. And this actually leads to a really common misconception about those hosts. Your standard city mouse, the one you might see scurrying across an apartment floor, the mus musculus, is incredibly low risk for hantavirus. The real threat comes from rural rodents, like the deer mouse or Paramyscus. So, if you're cleaning out a rural cabin and see a large mouse with a white belly and big ears, you need to be on high alert. That is your classic hantavirus carrier. So, if you can't get it from a bite, how do humans actually catch it? Well, the exposure route is entirely respiratory. Imagine you're sweeping out a dusty garage, an attic, or a storage space where infected deer mice have nested. Their urine and droppings mix with the dust, become aerosolized, and you simply breathe it in. You literally don't even have to see the mouse to become a victim.
Section 2. The anatomy of infection. A betrayal from within.
Once it's inhaled, this virus executes a masterclass in biological sabotage. It's really a 3-step attack. First, viral entry. The virus deposits deep into your lower respiratory tract, infecting alveolar macrophages. Next, it actively evades the immune system, buying precious time to enter the bloodstream and spread. Finally, it triggers massive endothelial dysfunction. It specifically targets the microvascular endothelial cells, which is the delicate lining of our blood vessels, leading to catastrophic capillary leakage. If we zoom in on that stealth phase, it gets really fascinating. The virus uses surface glycoproteins to essentially dock onto beta-3 integrins on our endothelial cells. But here is the truly devious part. To replicate in secret, the virus actively delays our cells from transcribing interferon beta. Interferon is basically our cellular early warning alarm. By silencing that alarm, the virus multiplies and spreads deeply into our vascular barriers, completely unnoticed. But here is the ultimate betrayal.
Huntavirus doesn't actually destroy our host tissue directly. No way. It doesn't cause cell death like a lot of other viruses do. Instead, it waits for our immune system to finally detect it, and then it tricks our own body into doing the lethal damage for it. This wild overreaction is known in medicine as a cytokine storm, and it is exactly why this virus is so deadly. Basically, when the body finally spots the massive viral replication, it panics. It launches an incredibly aggressive immune response. CD8 plus T cells, macrophages, and natural killer cells flood the tissues, dumping huge amounts of pro-inflammatory cytokines like TNF-alpha and IL-6. This hyperactive overreaction causes the junctions between our blood vessel cells to just loosen up and fall apart.
Section 3. 2 deadly syndromes. Because of all that intense vascular leakage, the infection actually manifests in 2 distinct geographically separated ways across the globe. We see Huntavirus cardiopulmonary syndrome, or HCPS, primarily in the Americas. Strains like Sin Nombre and the Andes strain, the exact one from the cruise ship, target the lungs. The capillaries leak so much that fluid fills the alveoli, leading to rapid hypoxia and cardiovascular collapse. On the flip side, the Old World strains in Europe and Asia cause hemorrhagic fever with renal syndrome, or HFRS. These target the kidneys instead, causing severe hypotension and acute kidney failure. Section 4. Diagnosis and defense. So knowing how fast and brutal these symptoms are, how do doctors actually confirm a patient has hantavirus before it's too late? Well, the CDC uses a very strict algorithm. In the first 7 to 10 days, they can use a reverse transcriptase PCR. But standard confirmation looks for a 4-fold rise in antibodies using serology ELISA tests. Now, if you want absolute certainty, the plaque reduction neutralization test, or PRNT, is the undisputed gold standard for final confirmation and figuring out the exact species of the virus. But it's equally important to talk about what does not work. Quick fix rapid tests and standard immunochromatography, they are simply not considered confirmatory for hantavirus. The stakes are way too high, and the margins for error are just too small to trust anything less than the gold standard laboratory tests. And those gold standard diagnostics are absolutely critical for one terrifying reason. We currently have no FDA-approved vaccine and absolutely zero specific antiviral treatments for hantavirus. When a patient crashes, doctors can really only provide supportive care. We're talking oxygen, fluid management, and just hoping the patient's body can survive its own immune response. Prevention is quite literally our only real cure right now. Which brings us right back to the chilling reality of the MV Hondius, with the Sandus strain proving that human-to-human transmission is not only possible, but highly effective in the close quarters of a crowded ship, and with 0 vaccines in our medical arsenal, we're left with a massive question. Is simply avoiding moral mice enough anymore, or are we watching the dawn of a highly lethal, globally mobile pathogen? Definitely keep that in mind next time you travel. Thanks for joining me on this explainer, and stay curious.